You get plastic surgeons telling you the procedure and telling you it's going to be drainless, you're going to love it. You're not. Use the drains. The drains are for you and they're going to make your recovery better and your outcome look better. Hi, Itay Wiser, a plastic surgeon. One of my most common procedures is breast reduction, which I usually often use drains, and a lot of patients are afraid of drains. And you need to drain it, you need to deal with it for a week. For many patients or potential candidates for breast reduction, this is an intimidating factor which they don't want to go through the procedure itself. So I want to break some myths about the drain and explain why we use it. So in a breast reduction surgery, a surgeon comes in and basically destroys the lymphatic system. It's a system of tubes and channels inside the skin. It's actually everywhere in the body, but specifically in the skin, it's in charge of basically shifting and moving fluid from the skin to the heart. And the surgeon destroys it during the surgery because we basically incise or cut through the tissue and shift tissue around. So we disrupt the integrity of the system. And what happens because of it is that fluid that used to be shifted back is now stagnant over there. And it gets worse because there's inflammation there, which invites more fluid to the area and nothing takes them from there. And this is why we leave a drain. A drain is basically a passive suction system that shifts the fluid out of this surgical plane that we have created and keeps it with minimal fluid as possible. Comes to replace temporarily the function of the lymphatic system. The drains are not painful. What is painful is sometimes the suture itself that secure the drain to the skin. And by doing so, when the drain pulls out a little bit, people feel it. There's a simple solution to it. And what we do, we inject local anesthesia that lasts for 2-3 days. And therefore it numbs the area and people feel it less. Another thing is you want to secure the drain, keep it hanging on the bra so it won't pull. And you instruct the patient not to pull on the drain or keep it secure and safe. Makes it much easier to handle.